He can't just say Michael Weiner.
Yeah, okay, so let me start.
Well, he can, but...
So there's this guy at MHS, Michael. No. So really, my biggest challenge right now is to get more data. It's to get more data in the hands of the clinicians and get more data in the hands of the patients, right? So I think it was Sanjay a few minutes ago said that we've got, these what we call lumped parameters, right? It's a very technical word, but it's, the heart rate, your weight, your glucose measurements, and it ends up that there are about 200 of those. And we're trying to make all of those accessible now. And then you go to the genomics discussion. There are about 20,000 genes. Well, can you imagine giving somebody their genomic data? You wouldn't know what to do with that. I don't know what to do with that, but it's going to be a big data set. What Sanjay didn't mention, which is really, the gene discussion is the tomorrow discussion. The day after tomorrow, we're going to be looking at our proteins, the things that are in our bodies. 2 million of those. So we're going from 200 items to 20,000 items to 2 million items, all of which are going to be able to tell us how we're feeling and what the predictive outcomes could be. So we need to bring all this together, the stuff that we know today and the stuff that we're going to know tomorrow in a way that's useful information for patients and for doctors. So from my perspective, this starts with what we're doing now with the blue button, making a little bit of information available, getting rid of the clipboard, making sure that everybody who's authorized to see it can see it. And then we're going to go to this open source model where we're making sure that the standards are clean and clear, that the connections are hygienic to make sure that they're safe, private, and secure. But most importantly, from my perspective, is opening the aperture of innovation so that it's not just, the 4 or 5 large systems integrators selling billions of dollars worth of broken software to the federal government, putting patients' lives at risk. That's really, for me, the biggest problem of it all. And then we're going to cross the line. I'll know that we've succeeded when we really have those innovations. The first time somebody says, something, I don't like my pharmacy package in this hospital, I want a new one, and they can do it at no cost in the next day because the standards are there, because the interoperability is there, because the data is already flowing. That's how we're going to know that we won.
Wow.